Hi, everyone. Thank you so much for joining us today. We are having Caitlin Synovec present. She is an occupational therapist in the role of the Medical Respite Program Manager for the National Institute of Medical Respite Care and the National Healthcare for the Homeless Council. Funding for this webinar is provided by Oregon's Administration for Community Living TBI State Partnership Grant. So with that, Caitlin, I'm going to turn this over to you.
Great. Thanks so much, Amanda. Thank you everyone for joining for this webinar today. We're going to be focusing on accommodating for brain injury in vulnerable and at-risk populations. So this is a continuation of a webinar that was recorded earlier this fall regarding vulnerable and at-risk populations and screening for TBI. So today we're really going to try to focus on what do you do next once you've identified that someone has a history of TBI. Before I get into the really specific accommodations, I'm going to talk a little bit through social determinants of health and what that has to do with brain injury and brain injury recovery. So there's a few different definitions regarding social determinants of health and what they are. It's become a more frequently used term in a lot of different health worlds. Today I'm using the framework of the Centers for Disease Control definition, the CDC, defining it as conditions in the environment in which people are born, live, learn, work, play, worship, and age that affect a wide range of health functioning, quality of life outcomes, and risks. So really what we know is that social determinants of health are all these factors in the environment in which we live, the context in which we live, and really are the primary cause of health inequities across several communities. So the CDC has identified 5 key areas of social determinants of health in Healthy People 2030, which is a continuation. Most folks are probably familiar with Healthy People 2010 or Healthy People 2020. So these are the 5 key areas. The World Health Organization also provides a definition of social determinants of health and what those key areas are. They're a little bit different, but there's certainly some overlap here. So again, today focusing in the framework of the CDC, looking at healthcare access and quality, education access, social and community context, economic stability, and neighborhood and built environment. And these are really the 5 key areas that can affect a person's health. And with TBI, really affecting health and recovery. I'd also like to talk just briefly today about racism and discrimination and social determinants of health as racism comes more into the forefront of our communities and our world and seeing its impact long term on individuals. Wanted to touch on that today, although we could certainly spend a whole session thinking about these things. But really, racism and discrimination has been proposed to be considered a social determinant of health. It sort of cross-cuts through all those key areas that was identified by the CDC. There are several communities within the United States that experience racism and discrimination, and this is inclusive of persons of color, sexual and gender minorities, and women. And one person may not fall into just one of those categories, right? You could fall into several of those categories and experience discrimination as a result of all of them at different points in your life. And experiencing racism and discrimination really in terms of the context of social determinants of health can impact trauma and chronic stress, poor health care, overall your ability to access certain resources in the same way. And I think a really good example of this is the doctor who was recently, saw it in the news, you might have seen it, who had COVID-19 and was in the hospital and reported that feeling that her care was not as good and that her medical providers were not taking her concerns as seriously. And unfortunately, as a result of COVID, she died, and perhaps as a result of that lesser care that she was receiving. And unfortunately, that's really a common experience for people in different groups throughout the United States, especially persons of color, but in other areas as well. And so that's a framework that we really need to be considering in TBI work, because as we know, TBI affects and can affect everyone, and we are going to run across people from these different groups within the work that we do. And discrimination and inequities can be both personal and systemic, right? Within that story of the doctor, she was experiencing personal discrimination and racism. However, we know that within healthcare systems that there is systemic barriers that are born out of racist ideologies and programming. And so we really need to be aware of that and working towards dismantling that to give everyone equal care, essentially. And again, I'm not a particular expert on that, but there's a lot of resources out there that I would really encourage you to read more through. And so when we're bringing this all together in regards to social determinants of health, TBI, and health services, looking at the framework through TBI recovery. And two of the strongest predictors of social integration and outcomes after a person has a TBI are social support and education and cognitive reserve. And going to speak a little bit more today in the accommodations on that education and cognitive reserve piece, and social support will be in our next webinar. But thinking about how these social determinants of health can affect these two things and then therefore affect TBI recovery. So what we know about social determinants of health is that they disproportionately impact low-income individuals or persons living in poverty. We know that social and economic factors can really impact recovery outside of the person's physiological experience. So in TBI recovery, there's certainly, the extent of the damage or the location of the injury has an impact of recovery, but also these other external factors really, really can impact recovery as well, and impacting somebody's ability to manage their healthcare needs or reintegrate back into the community and resume their previous life roles. And these social determinants of health can also impact cognition, pre-injury and post-injury, and may exacerbate what might have been caused by the injury. So our cognition, I'll go into in a couple of slides here, is really impacted by the things happening around us. And those social determinants of health are those things happening around us and can really affect TBI recovery. So again, sort of looking at this framework here, we'll get into the social and economic factors more in another session, but thinking about how these things affect our TBI recovery. It's not just about that physical recovery or maybe what the immediate healthcare was, but that cognitive reserve, what was there, what skills were available to us, what experiences we had before injury, are really affected by social determinants of health. And if they're decreased before the TBI, it's going to be harder to recover those back. And if we have those occurring around us after the TBI, it can certainly make recovery more difficult. So what are these factors that impact cognition, especially in terms of social determinants of health? So in the left-hand column, you can see the different medical conditions that can impact cognition. This includes if there's a developmental disability, people with HIV can experience cognitive impacts, substance use and serious mental illness, especially in the context if the symptoms are more active. If the person's had any sort of medical intervention or being in the ICU, or maybe they've lost consciousness, certainly can have an effect in addition to the TBI and overall chronic conditions. So we see impact of cognition from long-term diabetes care, long-term hypertension that maybe is not managed. Those can all affect TBI. Outside of the person, all of these things around us really can affect cognition as well. So if we don't have safe or stable housing, if we don't have consistent access to food or a source of nutritious food to feed and nourish our bodies, experiencing sleep deprivation, which often happens if a person is experiencing homelessness or is in an unsafe sleeping environment, trauma and stress, which are two separate things. We can be an acute stress event, and in that acute stress certainly have cognitive impacts, but if that stress has long-term, or we've experienced a traumatic event or long-term trauma, that's going to add into that as well. And then also low literacy, right, which is a result of some of these social determinants of health in terms of educational access and support. I also want to just bring up the impact of COVID-19, right? It's really prevalent and present right now. And we know that it's affecting people who are more affected by social determinants of health. So there's certainly been an increase in unemployment, which has resulted in some people moving into poverty or moving further into poverty. There's also been an increase in homelessness as a result of loss of wages, loss of jobs, and housing instability, and the continued uncertainty of the eviction moratorium. So it keeps getting extended, but there hasn't been rent relief. So folks who are, basically kind of on the brink of losing their housing when these moratorium ends without any sort of support that's happening, we're going to have a large wave of families and individuals moving into homelessness. We know that COVID-19 has had a much greater impact on low-income and minority communities for a number of reasons. And so these are folks who are facing these impacts even more than the general population. And then we also know that there's been long-term and neurological impacts and also psychiatric impacts after a person has had COVID-19. And just like the other social determinants of health are being part of different groups, a person might be impacted by all or one of these. Certainly the impact is going to be greater the more of these categories a person falls into. So these are all really important considerations that we need to bring to mind when we are working with folks with TBI, because it's not just about the physical presentation that's coming, but it's what is happening in the world around them. And our accommodations need to be mindful of that. So where do we start? I'm going to talk briefly about screening today. So our screening for brain injury, we went through that really thoroughly in the previous webinar. So I'm going to just touch base on it today, but it's a starting point when you're working with folks where the history of TBI may not be well known. And there are certain vulnerable and at-risk populations that are more likely to have a TBI and really would benefit from cross-screening. And that's adults experiencing homelessness, victims of domestic and interpersonal violence, adults who have been incarcerated or who have been engaged with the criminal justice system, adults who are living in poverty, folks who are living in underserved rural and frontier communities, and veterans, especially in the dishonorably discharged veteran community. So those are folks who don't have access to VA benefits because they were discharged from the military, often for behaviors and actions that they're finding now are frequently related to a history of a TBI or concussion. So these are the groups that are more at risk for having a TBI, but less likely for that TBI to be diagnosed. And so in all of these cases, right, there's significant impacts that happen if we don't know that there's a history of TBI or the TBI hasn't been treated. It would be very difficult. It is very difficult for people to leave an abusive situation. Being able to remember shelter or program rules, like showing up at certain times, this is when certain activities happen, you have to check in at this point. Following rules and procedures can be more difficult, and really difficulty navigating complex and resources and systems, which is perhaps why some people don't engage in resources that seem to be available to them, because it can be really difficult to identify, execute, and follow through on the plan to work through these systems. It can be hard for, an experienced healthcare worker to navigate through these systems sometimes. So even more difficult if you're someone who does not have a lot of resources and a history of TBI. So we definitely want to screen for brain injury. I've talked through a few of these points, but an untreated TBI, if the person didn't seek medical care after it happened, there's not going to be documentation of that and in any of the medical charts. If it's too far in the past or too remote, it's not going to be visible on something like an MRI or a CT scan. And the folks who are working with the individual right now are not going to have that information. Maybe it's in a medical record, but from 10 years ago, and we don't have access to that. And really the last bullet point is the most important. We want to screen because the effects of TBI can be long lasting and can impact the treatment and services somebody is receiving. And that's really critical. As service providers, we want to make sure that our services are the best that we can provide to our clients. So these are a few indicators for screening. Again, I'm not going to read through all of these. They're definitely available in the handout and in the previous webinar. There are definitely some things to consider if perhaps you can't screen everyone who comes through your service or agency. Here are some things to look for that might indicate a need to screen. And again, sort of a lot of these indicators have to do with falling into certain groups of folks or having certain symptoms. So we would definitely recommend using the OSU TBI ID. There's several screening tools out there. The previous webinar goes through administering the OSU more significantly, but partially it's recommended is because it's been tested with the variety of populations, and a lot of these populations that we're talking about in today's session, people who have been incarcerated or in the justice system, people experiencing homelessness. So it's been found to be valid and reliable with these populations, which can be hard to do sometimes. We don't often find tools that are specific to these folks. And there's A lot of online supports available. So there's the previous webinar, certainly, that we talked about, but the developers of the forum, Dr. Corrigan, have an extensive website that includes where you can download all the forums. There's extended online training available for free. You can read through the publications and the validation process that they went through and other resources. And I know Dr. Corrigan has worked with several communities to develop a screening tool sort of specific to their needs that would encapsulate the questions that need to be asked. So I highly recommend using these resources, especially if you're working to establish screening in your agency. So now we're going to get to sort of the meat of the presentation today. Perhaps that we know that we're working in with these vulnerable and at-risk groups. We're starting to screen for a history of brain injury. We find that there's, a really high prevalence rate. What do we do next, right? So how do we work with these individuals better once we know that this issue is here? The nice thing about accommodating for cognition is that generally these strategies work for everyone, and they may be useful for the entire population that you're working with that might have cognitive impacts primarily from all of those external things that we talked about. And so it's really, these are some good strategies to have in your toolbox either way. And so there's a sort of three categories of things to accommodate for brain injury. One is to build the alliance, right? Build that rapport, build that therapeutic alliance with your client. And we're going to talk through that today, as well as building compensatory routines. So establishing the personal environment, assisting with these organizational pieces, and implementing compensatory and self-management strategies. The third category, developing a supportive environment, I'm going to go through more specifically in our next webinar in terms of more systemic strategies. So what is cognition? I've thrown this word around a lot during this webinar. So the definition of cognition that we're using today, and certainly you might find different variations of this, is information processing functions carried out by the brain that include attention, memory, executive function, comprehension and formation of speech, calculation ability, visual perception, and praxis skills. And so these cognitive processes can be unconscious or conscious and are divided into the subcategories here. So basic level skills, that's our attention and memory, being able to focus, being able to remember information. Executive functions, which are our planning, our problem solving, our organizing a task, making sure we have everything we need before we get going, completing the steps in the appropriate order. And then metacognition, which is our awareness of self, right? Do I know that I have deficits in this area? Do I know what my strengths are? Do I know once I do a task, can I give myself an accurate rating about how I did? And that's metacognition. So sort of being self-aware and being able to work through and identify barriers and identify strategies to meet those barriers. There's certainly a lot more depth that can go into regarding cognition and cognitive processes. There's a few resources suggested at the end if you're interested in diving more into what those are. Within memory processes, there's probably 8 different kinds of memory. Not going to go that technical today, but that information is certainly there if that's something you want to learn more about. So what can TBI look like? And the words up here, these are not positive descriptor words, right? But these are words that we might hear in clinical settings, especially if we don't know that somebody has a TBI. They might be described as disorganized, grandiose, stubborn. They jump to conclusions. They can't get started on something. They can't finish something. They say they're going to follow the plan, like, yeah, I've got it. I'm going to take care of A, B, and C. And then next time you see them, there's been no movement forward. These are all the things that TBI can present as. And again, that's why the screening is so important, because it changes the paradigm, right? This isn't a stubborn person. This is a person whose brain is working differently. And therefore, how we go about achieving things needs to look different. There are also other things that we need to consider when we're working with someone with a TBI, right? And it's those external factors, those things that are going to impact our cognition regardless. So our amount and quality of sleep. I think any of us can relate to having a poor night of sleep and how that affects our focus, our emotional ability the next day. Our ability to handle frustrations is going to change depending on the amount and quality of sleep. And so if your person is chronically not getting sleep, that's going to affect how they're able to learn. The acuity of mental health symptoms. So, Baseline cognition isn't always impacted if someone has a history of depression or schizophrenia, but if these diagnoses are active, if these symptoms are active, somebody in acute depressive episode is really going to have more difficulty with cognitive tasks. Certainly our level of stress and emotional distress. Again, I think after this year, again, this is all relatable. This chronic ongoing stress sort of affects our self-regulation, affects our ability to, again, pay attention to things that are more complex. And so coming in after especially an acute stress event, maybe getting from the waiting area to your office, something occurred, right? That person is not going to be able to dive immediately into like, all right, we're going to work on your attention today, right? So being mindful of these other things. Medication, certainly, if somebody's going through medication changes, especially for seizures or things that are going to make them feel drowsier, that's going to affect cognition. And pain. There's a lot of people living with chronic pain or have difficulty treating their pain. And pain, again, is really going to affect how we feel in the moment. And with folks who have fluctuating pain levels, one day they might be fine because the pain isn't as big of a factor, but continuing on, it's going to be more of an impact the more pain that they're in. So we need to consider those other things because we need to help orient and start the time that we're meeting with the person and help them get centered into what they're doing, right? I'm throwing a ton of information at you today, a lot of strategies, and that's going to be cognitively overwhelming, even if you're feeling well rested and really focused today. And so anytime you're starting to dive into something more cognitive or more difficult, check in with yourself and check in to see how the client's feeling. For you, some of this work can be difficult, especially in working with someone who's learning and needs a lot of repetition. It's good to make sure that as providers, we're in a good space, right? That we're feeling patient, that we're feeling kind, that we're feeling ready to work on this. And check in with the client too. Maybe there's a lot of other stuff on their mind that today's not the right day for it. And there's still some strategies you can use to help it be a productive session, but it might not be the day to introduce a new skill. So one thing I always recommend is kind of once you've had this check-in before getting started, just take a few deep breaths or a moment of quiet before starting. Or I've had clients where we listen to a song. It's a good sort of 3 to 5 minute centering to get grounded into what's going on and what's happening, getting their mood into the right space for what we're about to do. And so I think that can be really helpful just to get started in that way. So we'll do that together, right? I like to instruct people to smell the flower or blow out the pinwheel or the candle, whatever is more relevant. But sort of breathing in for 3 to 4 seconds through the nose. And then slowly breathing out, maybe 3 to 4 seconds. And even that one simple breath can really help regulate the nervous system, slow us down. For some people who are talking too fast, like me, slowing our rate of speech, getting centered and focused, and doing that even just 3 to 4 breaths with the person can help orient and get ready. And if the person is presenting with something really difficult or really overwhelming, you might need to change the task, right? The focus of the day might just need to go somewhere else. So I'm going to dive into all these strategies to address cognition. Again, it would be unlikely that after listening to me talk through all of this today, it would be encoded in your memory, something that you can use and memorize. What I would recommend is using the handout, the PowerPoint from today as sort of a guide. Pick maybe 2 to 3 strategies that you're going to start using, start implementing with clients, and then sort of build your toolbox from there. It's hard to try all of this at once. So maybe just picking a couple of things to work on with clients, get comfortable and get familiar with, excuse me, and continuing to build from there. So the strategies I'm going to present to you are strategies to address insight and awareness, communication, attention, memory, and executive function. And what you'll notice is that with several of these strategies, there's a lot of overlap and a lot of strategies that work for multiple areas. So without being perhaps a neuropsychologist, we're not necessarily going to assess each of these specific pieces of cognition and dive in and say, today we're going to work on your attention, right? These strategies are more for you to, when you note barriers in certain areas, to be like, what, this strategy might be helpful. Let's try that, and can be used really by anyone working with folks with brain injury. So when we're talking about insight and awareness, we want to think about what works and what doesn't work. So what works is providing education. If you've had a history of a brain injury, this is how your brain might be impacted. These are the things that you might find difficult for you. Doing standard rapport building, using motivational interviewing, or sort of that, whatever strategies you use to sort of build your alliance, build the team with the client. Establishing therapy as a support system to achieve goals, focusing on what that person's goals are and helping them see that working with you is a way of getting to those goals. Some people need more external motivators, perhaps their insight is less. And so, identifying tangible goals to work towards. Like, I know this paperwork is a lot and it's really hard to sit through, but this is going to help the process of getting Social Security income so that you have consistent income, right? Money is very motivating for everyone, but just so the person can see what the outcome of the activities are. Also might be worth examining if it's a lack of insight or a lack of acceptance, depending on the nature of the brain injury or the nature of the deficits experienced. It can be really hard to accept that the brain has changed or that the person might not be able to do things in the way that they used to be able to do them. And so just, noting and again, using that therapeutic alliance to explore that. But in that case, it might just be more using the external motivators, right? If the person's not ready to talk about how they're feeling about it. And in some cases for people, the part of the brain that was impacted by the injury is the part that affects self-reflection and insight. And that might not be immediately realistic to build those skills. And again, that's when the more external strategies are going to be helpful as opposed to trying to provide that education and insight. So it's going to depend on the person and sort of the nature of the injury. Regardless, what doesn't work is directly confronting the client, exposing them in front of other people. You're late every day for a group. Why are you late every day? Like, this is a problem. We need to work on it. Doing that in front of other people is embarrassing, certainly a way to break rapport, and not a way to help the person be wanting to engage in what the problem is. And then not involving the client in the goal setting process. Sometimes that can be tempting if the person doesn't seem to have insight. Like, I know they have a problem with following through on things, but if that's not their goal, then you're going to need to find a way to work that in or work in the middle. But if you're only working on your goal as the clinician, it's going to be really hard for the client to get on board, especially if they can't see why or the purpose of it. So now I'm going to talk through communication a little bit, and communication is certainly complex. And so you might have folks who have difficulty with language. So not being able to find or use the right word, or replacing words with the wrong word, difficulty pronouncing words, or having misunderstandings. In certain cases, this could be a clinical aphasia. In some cases, it's not quite aphasia, but the person is still having difficulty expressing themselves effectively. The person may also have some difficulty with pragmatics. So being more tangential, not necessarily being aware of personal boundaries, or, what's appropriate to say to someone you just met versus someone you've known for a long time, may not pick up on social cues. These folks are probably those who've had a hard time, especially as COVID-19 started, with social distancing and changing in norms, and sort of our basic social cues, like we can't see if someone's smiling or frowning, is going to make it even more difficult reading nonverbal cues. So what do we do about it if someone has difficulty with communication? And really, these communication strategies can be helpful for a wide range of folks, but simplify your messaging. Make sure that you're delivering your information slowly. So what I'm doing today is not a good example, right? Breaking things down into simple sentences, one at a time, giving the information slowly, allowing time for that to be processed, making sure that you use language familiar to the client. So as a medical provider, sometimes it can be tempting to sort of fall into your medical terms, but make sure that the client knows what you're talking about. And the AHQR, the American Health Quality Research Association, actually has some really good resources on health literacy and making sure your materials are accessible to people at different levels of reading literacy, but also health literacy. When you're communicating, you also want to make sure that your environment is quiet, it's distraction free. And if the person, you're working on communication and building those skills, give some feedback on the interactions, appropriately. Say, hey, you're sitting a little bit close. Do you think that that's something that can make other people feel uncomfortable. Try scooting back a little bit and see how that feels, right? That's going to require that therapeutic alliance first, but that's a safe space for the person to get feedback and to learn in a less confrontational way. Also helping the person just with communication in general, do they have a phone? Do they know how to use it? Can they make a call? Can they use text features to help them be able to communicate and engage with their support systems? And then helping to organize conversations, provide organizing statements for the client, help the conversation stay linear. If someone is tangential, it can be really easy to start here and end up way over here. And, sometimes it starts to feel like your sessions or working with them are not productive because you're jumping all over the place. So as the provider, helping the person stay focused and stay on track. And then really importantly, this last one here, and this will be a strategy you're going to see over and over again, is checking comprehension. So asking the person to give a demonstration of the information instead of saying yes or no to your question. And that's really important because often folks will say yes to answer your question, especially if there's any sort of power dynamic, right? You're the provider, they're the person. They don't want to look dumb. They don't want to look like they haven't been listening. They don't want to get in trouble. And so if you're saying, oh, do you understand? They're likely going to say yes, even if they don't. So instead, say, can you show me, the instructions that I gave you, what I want you to do? Can you repeat back to me what I said? And helping make sure that they got all the information in. So a few more details on an organizing statement. You want to state the purpose of an interaction. I'm going to ask you a few questions today to figure out what services might be helpful. I'm going to go through and we're going to review your medical chart to see, what your most prevalent medical concerns are. So helping the person orient and know what it is that you're going to be talking about with them. You can also cue the topic. I would ask to see how you get things done during the day. What does your typical routine look like? So again, they sort of have this idea, here's where the conversation is going, here's the topic that I should be focusing on. Also emphasizing important information. If you're teaching someone really something very important like medications where you don't want there to be a miscommunication, being really clear. You have two medicines. One is for diabetes and one is for blood pressure, right? And then asking the person to repeat that information back to you or show you that information and really just focusing on those key concepts and not necessarily more details at that point in time. If it's a longer session or you're trying to get a few things done, stating the order of events, right? Saying, okay, first we're going to talk about housing today, and then we're going to get ready for your next appointment. And that can be helpful with keeping the conversation on track. If the person starts to derail, you can even write it down and give that visual cue like, hey, we're still on topic one, like let's get this finished so we can jump to the next thing. And just bring that person back. It's acknowledging that they have these other concerns and ideas going on, but at the same time helping stay focused so that you can move through and accomplish what you need. So checking comprehension. These are, again, just some examples of ways to check comprehension. If you had a session loaded with a lot of stuff, like, hey, we talked about a lot of different things. What was most important, right? That would be a good check-in for yourself after listening to this webinar. She went over a lot of tools. What do I want to remember? Having the person summarize what they talked about or what you did in your session. Having the person tell you what they understood. Having the person show you, right? So it takes out again, that sort of like right or wrong, and you're just asking them to demonstrate. It's also going to help you pick up on where there might have been miscommunications, misunderstandings, errors, or they just didn't get the information, right? If it's a multi-step process. And that can really help prevent larger problems from happening, which is really important. Tell me what you're going to do next. We talked about this at the end of the session. What are you going to do when you leave here? And I can tell you, if the person can't remember what they were going to do at the end of your session, it's going to be even harder to do that when they go out in the community with all the other distractions of life happening. So if a person has some problems with attention, you might notice that they have trouble staying tuned in, staying focused. Might be the person who is constantly fidgeting and moving around or playing with things or getting up and down, sort of they're seeking that stimulation, or they might look bored. And so instead of sort of demanding like, sit still, you can't get up, you can't move around, instead sort of help facilitate that to help the person pay attention. So one of the things you want to do, commanding attention, right? making good eye contact. So don't be looking at your computer typing, while they're talking to you, because they're going to go off into another space. Highlighting important information. So you're giving somebody a handout. What's the key takeaway? What's the thing you want them to get from that? Highlighting that really clearly. And minimizing other distractions as much as possible. With someone who gets really unfocused, maybe, turn off the ringer on your phone or the sound on your computer so there's not that background happening. Breaking information down into shorter components is really, really helpful. So again, those shorter sentences, focusing on one point or one step at a time, giving them time to absorb that and then move on. And making it active as much as possible, right? Have the person participate in what you're doing. Maybe they're writing things down on the list themselves as you're talking through it, having them repeat it back to you, practicing and rehearsing. So as interactive as possible, and allowing movement. I know we think about this a lot with kids, right? With, not having recess and other things happening, what that does to their concentration during the day. So allow the person to get up, to fidget, to walk around, take breaks as needed, stretching in their chair, things that are not going to be, if it's in a group setting, which is less likely nowadays, but eventually will be again. But as long as it's not super distracting to other people, allowing for it and allowing the group to do it, right? There's probably several people in different settings that need these strategies for attention. So as a group, taking a break and stretching and getting up and shifting chairs and moving around the space will help people focus on what you're talking about. The person may also have difficulty with processing information. So sort of this bottom level is attention, right? If you can't focus, then it's going to be hard for you to absorb the information, process it, and remember it. So people may have great attention, but may have difficulty sort of encoding that information in their brain. So they might only hear part of what you're saying. They may be able to follow along for steps 1, 2, and 3, but 4, 5, and 6, that's too much and their brain can't do it. They might seem tired or fatigued very easily, very passive, sort of that non-participatory person. And it might just be that their brain is having trouble keeping up with everything that's going on and all the information they're being presented with. So again, slow it down and simplify, present one idea at a time, present the task in smaller steps, the instructions in smaller steps, giving time, I'm going to present steps 1, I'm going to let you absorb that, show me, and then we're going to move to step 2, asking for repetition and for the person to rephrase it. So a lot of similar strategies from attention and communication. And then difficulties with memory. So this might be someone who's inconsistent. They don't seem to, sometimes they follow through, sometimes they don't, sometimes they remember, sometimes they don't. They might have difficulty recalling events, especially details. Showing difficulty learning new information. So maybe with you, they show that they can do it, they repeat back, but then when you see them again next, they aren't able to remember all the steps. You might see this as a lack of follow through, or the report doesn't really make sense, or there's pieces missing, or seems that things that don't seem realistic because they're sort of placing events in the gaps in memory that they might have. So strategies for memory, writing things down, I think is the best strategy for memory, whether that's writing it in a planner, making a list, using an app or other phone features. You can really be creative with this. It's really about what's going to work best for the person that you're working with. You want it to be a usable system that they know, hey, like this is where my stuff is. This is where I can find what to do. I always tell everyone it's sort of a second brain, right? I have one here and then my other brain in my planner next to me that keeps track of everything that I need to do. Whatever that might be for the person, that's motivating for them to complete. Repetition again, right? So again, you've said something to the client, you've showed them something, ask them to show you, ask them to rephrase it back to you. That repetition of them speaking it, of them doing it, is going to help that information stay in their brain. And then testing their memory at various intervals, right? So maybe you explain something at the beginning of the session, see if they can remember again at 30 minutes, maybe 45, maybe at the end of like a 60-minute meeting. Again, if they can't remember within the context of that session, it's very unlikely they're going to remember it outside. And so that's a good way to know that, this person might need some reminders, they might need some cueing in the community. Maybe I need to call them tomorrow to remind them to do something, or that their next appointment appointment is this date, or texting them. We need a calendar alarm or alarm in their phone can be really good technical strategies to help with that. And then helping people just kind of get organized and noting like when this happens, and helping them make those connections. And then executive functioning is actually sort of a complex set of skills. So I'm going to talk through these skills somewhat individually, but they're interrelated, right? So they sort of one leads to the next one. And it's what helps us complete goal-directed multi-step activities. And they sort of executive function oversees some of these smaller cognitive processes. So that can include initiation, organization, problem-solving skills, and sequencing. There's can be more to executive functioning. These are the four that I'm going to focus on today. So initiation, again, this might seem similar to someone who has memory or attention or processing issues. They don't seem unmotivated. They're able to talk with you and identify all these great things, but they don't actually follow through on them. They need constant reminders to get started. People might describe them as lazy. They're like, they're just sitting around all day, not doing anything. They have all this time to get stuff done. It really could be that it's hard for them to figure out how to get started and how to do that. Somebody who has issues with organization, I think this is the one that visually we can identify with most, right? A person who might bring a bag or a backpack in and the papers are just everywhere. There's no sort of order to it. Personal belongings are kind of everywhere. Things are falling out, just appearing discluttered or disorganized. They don't seem to have problems with memory. They're able to remember information, but have a hard time actually accomplishing the tasks and are certainly unsuccessful in multitasking, which none of us are probably very great at, but this is especially so in people with disorganization. Issues with sequencing. So sequencing is sort of being able to complete a set of steps from 1, 2, 3, 4, 5 all the way through. Again, this person might appear disorganized. They might get started, but not be able to finish things or finish things out of order or miss steps somewhere. And they can also have trouble with initiation, but sometimes they're, getting the first thing done is fine. It's following up and following through on the rest of the steps. So some strategies, again, for initiation and sequencing. I think some of these are going to start to look familiar here. Simplifying the task, breaking it down into smaller steps and smaller goals. This is really, I think, an effective strategy for everyone, especially learning something more complex or new, just focusing on a few steps at a time. Visual cues can be really helpful for helping people get started and staying on task. Checklists are great. Like first do this, second do that. You might have one for your morning routine. In the morning before I leave the house, I need to wash my face, brush my teeth, take medicine, take my keys off the hook and make sure that I lock the door, right? And this checklist could be posted by the front door so the person sees it before they leave the house, in their wallet, wherever they're going to check it and reference it frequently. It can be helpful in the kitchen. Did I turn off the stove? Did I turn off the lights? Is the refrigerator closed? All these checklists can help people, sort of attend to these small details and follow through on tasks as needed. Sound cues can be helpful too, setting an alarm in the phone. Hey, it's time to take my medicine. It's time to switch over my laundry. Reminder calls, timers. So to help people stay on track, start a timer, and after 15 minutes it goes off. Check in. Hey, am I still working on the thing that I started? Or that timer is, okay, it's time for me to get up and get moving on this particular task. So I've mentioned simplifying a task or breaking it down into smaller steps a few times. So I'm going to go through what that might look like. So when you're simplifying a task, it's really helping the person break down the steps into smaller pieces so that you know exactly what needs to happen, right? Instead of saying, make a sandwich, simplifying the task is you need to get out all of your ingredients. You need to get out a plate and a knife. You need to pour yourself a drink, right? All these little details that go into that. So a few things that people can do as you're simplifying a task is have the person write down the steps before they get started. So you know that they're aware of what the steps should be, that they're not missing anything, and it helps them organize or know what they need to get. And that written list that they write out can be their checklist as they're going through the task, right? If you're following a recipe, check off those recipe steps as you go through it. If it's a larger task, can you divide it up over multiple days? Can you put in little reminders for yourself of different things to get done? Thinking about completing like a huge paperwork packet that might be hard to get done in one sitting, right? Breaking it into smaller pieces with explanations of how to do it, and have the person do it one step at a time. So additional strategies for organization and sequencing is that preparation, right? Having the person figure out, what do I need before I get started? There's nothing like getting into the shower and realizing that there's not shampoo in there, there's not soap, my towel is across the room, right? So thinking through, what do I need to be able to successfully accomplish this, and preparing that before we get started. And that eliminates some of the problem solving and the guesswork, or the frustration that can happen during a task. Again, that environment can be really helpful. Do I have, is it one that's conducive to focusing? Have I taken out some distractions? Are there ways to help me organize the information? Sometimes people find it helpful to label, like, this drawer is for socks and underwear, this drawer is for t-shirts, just to simplify these tasks. Visual cues, again, color coding or labeling. So I have a red folder for my medical information, my green folder is for my benefits information, my yellow folder is health handouts, right? Figuring out just some really simple systems that the person can consistently use and go to. And identifying a consistent place to store items. My key always goes on the hook by the front door. My wallet always goes on the table next to my bed, so that the person knows where to put things right away, but also where to then find them again. And that can make it a lot easier. My cleaning supplies for the kitchen are under the kitchen sink. Again, simplifying some of these things so that they're not thinking through every step as they're doing something. And again, limit multitasking and helping the person prioritize so they're focused more on one thing at a time. And there's a few strategies for prioritizing. One that I really like is kind of the brain dump strategy, right? So taking 5 to 10 minutes, and they write down everything that's on their mind. Doesn't matter what it is, anything that's floating around in there. I always use the visual, like taking my head off my neck and like shaking it onto this piece of paper. Everything should be in there. So that it's not floating around as a distraction. Then looking through that list, picking what are the 1 to 2 things that are most important to focus on right now? What are the things that I need to really take care of first? You can, for people who are more able to do that, you can go through the whole thing and categorize all of the activities that are on there. These are things that I have to do. These non-negotiable must get done. The things that I should do, it's like, I would like to get them done today, but if it has to wait a couple of days, that's okay. It's like laundry, today it's not imperative that I do it, but by Sunday I'm going to be out of, clean clothes. And so that's when I'm going to need to do it. And then the want to do, some things that I would like to get done, but they're not at the top of the priority list. And you can use that brain dump. The client can keep the list with them so that they can reference it. You can keep a copy so that sort of helps frame out your sessions when they come in, saying, okay, we accomplished 1 and 2, what's next on our list? And so you're not redumping every time, but giving priority. Clients who have a little more skill or more awareness can use this strategy every day just to sort of help them focus and figure out what to do next. So a person who has difficulty with problem solving, they might have trouble making decisions. They might not be able to apply the strategies. So they know that, I need to write down my therapy appointments in my notebook, but they might not necessarily generalize and say, I should write down every appointment in my notebook, or I should write down other tasks that aren't appointments in my book so I remember them. They're going to need more cueing to figure out how to use these strategies in more than one or multiple situations. So a few different things that you can do to help with problem solving. Identify what the potential problems might be. Some people have difficulty figuring out what could potentially happen. And so talking through them, what are the different ways that this could go? What happens if you take the bus and you get off at the wrong stop? What happens if you get off at the right stop, but you turn left instead of right, or you're confused? What are the things you might encounter, and what are the solutions to that? Doing that ahead of time can reduce a lot of stress and anxiety and help the person, be able to accomplish what they've set out to accomplish, even if it doesn't go the way they think it should. Also, just helping the person by providing options. Here are the 2 to 3 things that you can do to resolve this situation, right? just, any option that you give should be one that's feasible and acceptable. Never give something that you don't want the person to do. And then again, that step-by-step teaching, right? Giving specific instructions. If the person has trouble problem solving, and especially if they have issues with memory, don't allow them to guess, because they may not ever be able to come up with the right answer. Really, what you want to say is, do you know what to do next? And if they are not sure, say, okay, now we do this step, instead of saying, well, what do you think it could be, right? Some people aren't able to generate that. And linking specific strategies to specific actions. When you're feeling mad, right? When you're feeling mad, take 4 deep breaths. When you're feeling, and you might have to even be more specific. If you're feeling mad on the bus, take 4 deep breaths. If you're feeling mad, checking in for your appointment, take 4 deep breaths. If you're mad after a phone call, so helping the person recognize all the situations where that strategy might be helpful. So I know I loaded you up with tons of strategies today. So there's just some key takeaways, some things that I hope you'll remember, really before you dive in and working through all these individually. But, remove distractions as much as possible. Be as direct as possible. Minimize long, winding sentences and explanations. Repeat information. Check comprehension, make sure the person knows what you said, remembers what you said, is able to apply what you've said, helping them generate a plan for what's coming next. And then really use your time with the person to develop and practice these strategies, right? The person may need a few times with coaching and assistance to really get it, to really use it, to apply them, and to be able to apply them outside of your office. It will definitely take more than 5 minutes of like, oh, here's a calendar book, a pocket calendar, write your appointments in, right? You're not going to see a lot of use of that. But if you take the time in your session to say, all right, let's write your appointments into the calendar today. All right, let's pull out your calendar book. Let's check it. Have you written in your appointments? Have you used it? And talking through it will help the person develop the skills to do that. And just be reasonable and give people time to practice and adopt. Learning new skills and adopting new routines takes time for everyone. It can especially take more time if you're dealing with a brain injury and all of these other stressors and things that might be going on. So instead of jumping from strategy to strategy, if it doesn't seem successful right away, give it a little time to practice, to stick, and see if it starts to get more comfortable and familiar. And then after some time, if it's not effective, you can try a new one or add in something else. And finally, affect will be remembered more than content. So this is the part where that therapeutic alliance is really important. Did the person feel comfortable in my environment? Did they feel respected? Did they feel listened to? Did they feel like you were there to help them? Even if all the details of the information are not remembered, they will remember how you made them feel, and that is going to help bring them back and work on some of these harder skills and tasks. And so regardless of how hard it was in the session, try to always end it on a positive note. I'm so glad you came to see me today. I'm looking forward to meeting again. Those things that are going to draw the person in and make them feel welcomed. So our next set of webinars, like I said, we're going to talk about developing that supportive environment. So today was sort of these micro level strategies, these individual things to do with clients. We're going to talk through sort of some systems changes that can be made to really make the environment accessible to people with brain injury, but really to a lot of different folks. And so I just want to share a few resources here. So there's the previous webinars in this series, a lot of good content from Dr. Corrigan and Dr. Lemsky, as well as the screening tool. There's also some great reading to do on experience of discrimination in America, and reading through that as a social determinant of health. The OSU TBI resources I definitely recommend for folks in terms of screening. And then if you're more interested in kind of diving into these cognitive strategies, the American Congress of Rehabilitation Medicine has a specific cognitive rehabilitation training that goes through a lot more detail of these cognitive processes and some strategies for managing them. It's a great training, highly recommend it if you're interested in delving into that further. And then also the National Healthcare for the Homeless Council has recommendations and clinical guidelines for working with folks who are homeless or unstably housed, dealing with brain injury. So this document includes some of those micro strategies as well as the larger systemic. So all great resources. I welcome you to check them out. And again, building your toolkit and your knowledge here. So these are just references from today's presentation, and I thank you for listening.